The more that you use these are going to start to wear and tear a little bit, so you just want to replace them maybe like every 2 months, but that's for really high volume practices, so I don't know how much you guys are using it, but just keep in mind. All right, so the electrodes are where? The electrodes.
Oh, they're right here.
Yeah,
It's also very important that you guys find out what prescription your patient's wearing. I know that retina practices, it's kind of hard because you all don't really do any refractions or anything like that. But keep in mind that whenever we're testing our patient, whenever they're looking at the screen itself, it's not the checkers that are stimulating them, it's the edges between the checkerboard pattern. So if for some reason their vision is very blurry and they can't see because they don't have the, the right prescription, then their test results are going to be kind of off kilter. It can be so much of a difference that it can cause a normal healthy patient to look completely abnormal if you guys aren't correcting them right. So make sure that you guys find out what your patient is wearing before you're testing them. You also do not want to test them in their glasses. If your patient has a bifocal ad in their glasses, even if you can trust your patient to look through just the top portion of their glasses, the whole bottom part of that screen is going to be completely distorted because of their ad. That's also going to mess with your test results. So you always want to make sure that you're doing everything you possibly can to make sure that your patient has the best possible testing environment for them to do better. Okay. So when it comes to your conductive paste, you guys can never use too much, but you can use not enough. So obviously the one in the back of the head takes more than the one in the front. Okay, you go ahead and squeeze out what you need. You're going to hold it sideways and scrape it off. Alright, look straight ahead for me. Did you scrub this side of her forehead or this side?
The left side.
Okay, so I'm going to put this over here. Alright, so I'm going to have to see over here because I can't do anything from the left side. So we're going to measure, chin up nice and level. Make sure that we're in the right place. We want to get as close to her scalp as possible. We're going to hold her forehead and we're going to put all 5 fingers around this and we're going to wiggle it in. So it should actually be more of a cone shape instead of completely flat. If you press on that button, it's going to squirt your conductive paste out everywhere and you're not going to get a very good connection with her. So you want it to be more of a cone shape. The black one goes to the center of the forehead. Thank you, ma'am. So we want this one in the center of her forehead, right below her hairline. Again, all 5 fingers around. We're going to press and hold it. We don't have to wiggle this one. And then the green one is your ground wire. We don't want it on the temple, we want it on the bony process above the temple. You guys already know this, right? Okay, and then we're just going to twist these around so they're not hanging in her face. And then we're going to lightly tuck this behind her ear. Alright, and then we're going to measure her out for 39 inches. We need the ruler. So we need you to sit up in your chair. Make sure that you're nice and level.
Okay, let me just lower this. I think this is over it, or?
You should be fine. You should be eye level, so you're
Okay,
right.
fine.
Okay.
Scoot back a little bit.
Just stay here.
Perfect.
Little, yeah, that's good.
Okay. So then, do you feel like you're nice and centered with the screen? Okay. So let's hand her that occluder over there. Do you ever have problems with dry eyes? Do your eyes get dry?
No,
Okay.
but our patients do.
Yeah. You guys can give them an artificial tear. That way, if it helps them kind of stay focused, that's fine too. Some of your patients also, whenever you put those little electrodes on, it's going to be a little uncomfortable and you'll see that they'll blink a lot, which causes you guys to have a lot of artifacts, which kind of tank your test results. You can give them a drop of proparacaine, if that helps. Go ahead and come in, we're going to shut the door.
Oh, here. I'm going to stand here in case one rings. So.
Okay.
Are you starting with Personally, no, she did a lot before. Shut 2. You're the guinea pig for everybody.
Okay, and I would also recommend too that you guys get some like blackout curtains to put over these windows. You want it to be completely dark in here for your patients who already have pretty severe glaucoma or their visual acuities are pretty low already. Keep in mind that glaucoma starts in the peripheral vision and works its way centrally. So if we're in a completely dark room, whenever we show them that gray on gray pattern, it's going to give them a better chance to respond to us. But if it's light in the room, whenever we show them those gray patterns, it's going to kind of wash that out. And that's going to also make it harder for them to give you a good response. So you want it to be as completely dark as possible. So I would recommend that you put some curtains up over there. Okay, so then I'm going to move over here. test starts, you're going to see some checkerboard patterns on the screen. You will see a little red target right in the middle. I want you to look toward that little red target, but take in the whole screen just like you're watching TV. You can blink as needed, try not to overdo it, and no talking during the test, okay? And I'll let you know when we're about halfway through each one, okay? All right, so our sensor's nice and green. Alexa's already chosen. So I'm going to click on New Test. We're going to hit Run Test. And then I'm going to ask everybody to be as quiet as possible and not to move around during the test so that you don't distract her at all from taking the test, okay? All right, so blink a couple of times and look straight ahead. Here we go. Halfway there. Okay, could you see that okay? Okay, perfect. Blink a couple of times and look straight ahead for me. Here we go. Halfway there. Okay, so the very first test that we do is low contrast, which is looking at peripheral vision. So you see here we have these green bars, right? With low contrast is pretty smart. Whenever it pops up and says, was the patient focused on the screen, you can always say yes. Because it knows if we get a red reading or a white reading, it's going to say, let's just double check that and make sure that it's correct. It's not just a focusing issue. So it will tell you what to do. So we're going to say yes, and since she's nice and green, which is normal, we're going to move on to the high contrast test. So she still has her left eye covered. Blink a couple of times and look straight ahead. Here we go. Halfway there. Okay, and then you see our readings here for the high contrast. High contrast is not as smart, okay? So regardless of whatever you get for high contrast, whenever it pops up and says, was the patient focused on the screen, if you say yes and you're not paying attention to what you get, it's not going to know to repeat. So you have to physically look here to make sure that you're getting colors, okay? So we're going to say yes because we do have colors. And now this box is going to turn blue. That's just another visual cue for you guys that we're going to move to the other side. So we're going to have her go ahead and switch that around. Cover your right eye. Blink a couple of times. And look straight ahead. Here we go. Halfway there. Could you see that okay? Okay. I always ask them after the demo if they could see that okay, just because whenever you put them in those trial frames and trial lenses, if you don't get that axis right or it happens to slip on you whenever you're putting it on the patient, it's going to make them blurry. So that way, whenever you ask them, could you see that okay? If they say, well, it was really kind of blurry, you can go back and you can adjust the trial frames if you need to, okay? All right, so blink a couple of times and look straight ahead for me. Look toward the center of the screen. Try not to move your eye around. Halfway there. Okay, so you see here, these are the readings for low contrast. It's always extremely important that you guys aren't standing behind this device like this. You can see if I'm standing here like this, I have no clue what she's doing. It's very, very hard for your patients to mess up the test on purpose, but one of the things that they can do is not look at the screen. So you always want to make sure that you're either standing to the side or you've got this moved around. You want to have access to your patient at all times to watch them, to make sure they're not moving their eye around, they're not looking at the wall, things like that, okay? All right, so since we've got these nice little green bars here, it's going to tell us that we're moving on to high contrast. So I want you to blink your eyes a couple of times and look straight ahead. Here we go. Halfway there. So again, you see we have our nice screen readings here. So we're going to say yes. So what do you guys think the purpose is of me letting her know that she's halfway there?
She doesn't get impatient.
You got it. Keep in mind, right, keep in mind that whenever we're doing a VEP, we're actually measuring brain waves, right? So if our patient is sitting there thinking about all the things they have to do in their head, doing their laundry list of things, I've got to pick up my kid, I have to go to the grocery, how much longer is this test going to take? Exactly. That's going to mess with your test results. So if you just let them know that they're about halfway there, it kind of helps them say, okay, I've got this, I'm going to stay focused. It's just an easy way to help them. So what's this mean?
It
has to do with your AMI.
So they're gonna do what normal gonna do.
Perfect.
We want to make sure.
Looks beautiful. Okay, so we're going to close out this. Now I'm going to do an ERG with her. ERG is going to be a little bit different because they changed the way they want you guys to prep whenever it comes to ERG since you guys had your training. Okay.
Okay.
They actually have you